All right, well, I think we should get started because we do have a full agenda. So I'm going to turn it over to Kathy Hedin and or Karen Selvis to get us welcomed and started.
All right, go ahead, Kathy. You want to kick us off and then I'll take over.
Yeah, we planned this. You can tell already. Well, I don't have much to say right now. This is still, we are in the last week of Karen's interim deputy county manager role. I'm so grateful for her for these last 7 months, but just excited to listen to what we have today and have a nice discussion during this workshop. So Karen, please take it away. Thank you.
All right, thanks, Kathy. Madam Chair and Commissioners, yes, thank you so much for your time and attention this afternoon. As you may recall, we had a workshop, committee of the whole meeting in July, and then also made over to a meeting in August. So we came before you with many different topics, but none of which are the ones we're going to talk about today. So we're going to highlight some work in Ms. Tina Curry's area of the financial assistance services. She's going to give you some updates of CARES spending and specifically surrounding the landlord program. And then we are going to turn it over to Maria Weatherall, a director of Veteran Services, who is going to talk to us about the veteran registry. And then Ms. Ann Berry and Ms. Sophia Thompson are going to discuss a Rule 20s. And then we're going to wrap up. So if you have questions in between for each of the presenters, please ask them at that time. And there may be just a few minutes at the end for some follow-up questions, but I will now turn it over to Ms. Tina Curry. Thanks, Tina.
Thanks, Karen. Good afternoon, Madam Chair and Commissioners. I'm Tina Curry, Director of the Financial Assistance Services Department. Last month, during my 2021 performance measures and supplemental budget presentation, I provided an update on the CARES Emergency Assistance Spending Project. My comments reflected reasons why spending has been lower than expected and the department's plan to engage with County Manager O'Connor and Chief Financial Officer Alex Kutska to develop a plan to utilize the underspent funds. This afternoon, I am excited to share that plan with you. It is a plan that provides an economic benefit to landlords and preserves housing for renters. Before I get into the details of that plan, I want to briefly mention a few of the lessons learned from the CARES Emergency Assistance Project because those lessons helped to shape the Landlord Assistance Program. When it was announced, $15 million in CARES funding have been allocated to the department to assist residents with past due rent, mortgage, and utility payments, the department made the decision to expand our emergency assistance program and refer to this project as a CARES Emergency Assistance Project. From a systems perspective, it was a perfect solution because our emergency assistance program had established rules and policies that could be easily modified. In addition, most staff were familiar with the processing of emergency assistance applications. But from a race equity lens, the department should have named the program CARES Housing and Utility Assistance because that title does not carry the historical trauma Black and Indigenous people of color associate with the emergency assistance program. By historical trauma, I'm referring to the anguish and fear I heard from BIPOC residents that their application would be denied because they had already received emergency assistance within the past 12 months. I assured them this rule and many others were waived under the CARES project. However, their concerns were a reminder of how name association can have unintended consequences. In terms of the process, the department changed the CARES emergency assistance guidelines multiple times, each time to increase the number of residents eligible for assistance due to the underspending. That was great, that the department was able to be agile and adjust our criteria, but the frequent changes were hard for staff to track and remember. In retrospect, the department should have set the maximum approval amounts much higher initially and adjusted downward if there was a risk of overspending. Preliminary survey results revealed 95% of residents stated the payment resolved their issue, and 100% said it allowed them to remain stably housed. 63% said the assistance greatly decreased their stress, but difficulty obtaining the necessary verifications was cited as a challenge. Going forward, the department plans to look at what verifications are absolutely warranted and which ones can be waived due to the hardship of obtaining them. Regarding community engagement, when the department held its town hall regarding this project, numerous recommendations were made involving policy changes that were needed if the department genuinely wanted to support residents. I'm sure you have heard these recommendations from your constituents, such as the department needs to raise the issuance limits and allow double issuances. These are great programmatic recommendations, and they were all implemented, but they do not lead to the transformational change you would like, residents desire, and what the department wants to achieve. In 2021, the department plans to start dialoguing with cultural community agencies to see which ones would be interested in having a financial worker or two paired with their agency to respond to questions about program eligibility and processing applications. In our current work environment, contact would be remotely with financial workers holding weekly calls to respond to questions. The second phase of this community engagement plan includes creating a learning circle consisting of leadership from the cultural agencies, members from their client base, and FAS leadership, dialoguing monthly on policy and programmatic changes that are needed. The goal is for the cultural community agencies to become actively involved in shaping and developing policies and processes. Overall, the CARES Emergency Assistance Project achieved its primary goal of keeping residents stably housed, and the department learned the value of appropriate messaging, programmatic changes should be kept to a minimum, and how cultural community agencies can be engaged in transforming FAS policies and programs. Now I want to shift my comments to how the department plans to spend the unspent $8 million in CARES funds. I am thrilled to announce the department is launching a landlord assistance program. As you know, the COVID-19 crisis has forced the Ramsey County rental community to face many challenges. The landlord assistance program is in response to the economic impact small landlords have suffered since the pandemic began and the eviction moratorium that was ordered and then extended and extended again and again. All joking aside, this landlord assistance program not only benefits small landlords, but also renters because it preserves their housing and eliminates the risk of homelessness. The landlord assistance program is targeted at small landlords, and the assistance is for past due rent and late fees from March 1st to December 30th, which aligns with the CARES funding dates. Landlords can request assistance for a maximum of 50 units. The maximum amount of assistance that can be requested is $20,000 per unit. This program will require landlords to waive any eviction proceedings against a tenant, and it stipulates that the tenant cannot be evicted within 60 days from the date of the last payment received by the landlord. We want tenants to be aware their landlord has applied for the assistance. So tenants will receive notification that their landlord has applied for assistance, and they will also receive a written notice if the request for assistance has been approved. Tenants will also be advised to keep the notification letter in case their landlord attempts to collect the past due rent later. In terms of the process that has been created to access the funds, the work group tried to keep the process as simple as possible, but also meet all data privacy and legal requirements. A SharePoint site has been created so landlords can apply online. For landlords who do not have access to a computer or are not tech savvy, a paper application has been created. Landlords can obtain a copy of the paper application by calling and requesting one or by visiting one of the 5 service centers. To support landlords with the application process, there is a dedicated phone number that they can call and get their questions answered or additional assistance applying. The department plans a soft launch of this program today and will roll out the program to the public next Monday, November 2nd. Applications will be accepted through November 13th. Following approval and of applications and disbursement, if additional funds are available, there would be a second allocation. Landlords and property owners would then have until December 10th to submit an application. In closing, on behalf of the department, I would like to thank FAS Manager Shane Thor, Nabil Mohammed, who's our program specialist in FAS, Keith Latimer, Social Services Division Director, Max Holdhusen, Interim Housing Manager, Grace Lee, Health and Wellness Senior Management Analyst, Sarah Holly and Prince Corbett, our Racial and Health Equity Administrators, Gary Lawler, Social Worker, and community members, Thomas Berry and Deb Palmquist. And lastly, County Attorney Stacy Deandra, Amy Schmidt, and Lindsay Miller. Their support, guidance, and assistance enabled the department to create this program in less than a month. It truly speaks to their commitment and dedication in supporting residents of Ramsey County and the vision of this board. Thank you. Are there any questions?
There are. I'll start with Commissioner Reinhardt.
Thank you, Madam Chair. And I'm sorry, I'm so excited about this. And I'm like, okay. So it is a landlord assistance program because that's where the money goes. But it's really at the same time a renter assistance program because they don't have to pay the rent because the landlord is getting it through this program. So how does this work? Okay, so if there's less than 20 units, then everybody is treated the same. But what if there's 50 units and the landlord can only apply for up to 20? And is only for those that have is it only for those that have eviction notices? And then, so if it is, and there's more than 20 in the building, how does that work for each of the individual renters? But mostly, if you get $20,000, how do you know how long your rent is paid? Does that make sense? Because you wouldn't expect that the landlord would be able to get $20,000 if in fact there wasn't $20,000 worth of rent due, or that it would go further, so that they couldn't end up making more money than if they got the rent. So I'm just trying to figure out those two things.
Madam Chair and Commissioner Reinhardt, great questions. So say a landlord has 100 units. We said for this first round, could apply for assistance up to 50 of those units.
Oh, okay.
Okay, and if there's additional funding after the first round of allocation, then they could apply for funding for those remaining units that are behind.
So when the notices go out, does it go out to is it a certain 50 or is it?
The landlord would need to determine which 50 units they wanted to apply for.
Okay. So it is by unit. So somebody in one of the units that wasn't included would not get the notices.
Well, it will go out to the landlords. If the landlord knows that there's another unit on their property, then they could also, we're going to include in the application process, they can refer that tenant to our emergency assistance program because we still have funds remaining in that program. So the tenant could apply for funds from the emergency assistance, CARES emergency assistance program.
Okay, and so are the only units that the landlord is able to apply for this money for are ones that have eviction notices? That
is not the case, Commissioner Reinhardt. Okay. Landlord, you do not have to have an eviction notice.
Well, that's even better for the renter because they're not, hopefully not in that dire of a straits before there would be assistance given to the landlord, which really then assists the renter. Okay. And so then my last question was about the amount of money. I think, and maybe I misheard that too, but I think you said that they could get up to $20,000 per unit. So is that correct, first of all?
Commissioner Reinhardt, Madam Chair, that is correct. That amount was based on basically the fair market rate for a unit.
Okay, so how do they figure out how long that covers? Because if your rent, I mean, could they possibly make more money on a single unit than what they would have gotten if they had gotten rent?
Commissioner Reinhardt, great question. No, because they're going to have to submit like their ledger so that we have documentation of exactly, and the lease agreement, so we know exactly what they were charging for rent.
So depending on the rent, the actual rent, because that's what it's based on, if it's based on the lease, it could cover, if it was $20,000 and that's the maximum, it could cover more months or less months in the units, depending on what the rent actually is for that unit.
That is correct, Commissioner Reinhardt.
Okay, well, I was just trying to make sure that, well, you can see where I was coming from there. And so then when the tenant gets the letter, they know how much of the rent has been paid, so they know when their next rent payment will be due.
Commissioner Reinhardt, Madam Chair, that is correct. They will know, the tenant will receive two notifications. One, that the landlord has applied for assistance, and a second one, if the request for assistance was approved. And it will say the amount of the approval.
For their unit?
For their unit, for that specific unit.
Okay, so then they can calculate when their next rent payment is due based on that.
That is correct.
Wow, that's amazing that they got all of that done, or you got all of that done in such a short period of time. But how needed. It's absolutely wonderful. And I'm so glad that it's not just in for evictions, but helping people so they don't end up being evicted. So thank you, Tina.
Thank you, Commissioner Reinhardt. Yeah, it's another way of shifting that bureaucratic complexity onto someone who can better manage it. The landlords potentially.
I mean, it is
more
very exciting.
Structure. Yeah, it's very exciting. Commissioner Carter.
Thank you so much for sharing this work that will help to assist folks and keep them from being moved out of their homes. I had much the same line of questioning as Commissioner Reinhardt, so I want to thank her. I don't have to ask all my questions. Let me just check in then. First of all, you did say the CARES Housing and Utilities Program would have been a better title. And I did hear you say you can refer them back to the CARES Assistance Program. Are we going to change the name, or would that be more complicated at this point in time? That's the first question. And then I've just got one brief follow-up.
Commissioner Carter, Madam Chair, I think at this point, we should not change the name. I think it would just be add further confusion.
Yep, I understand. And then you did say that the landlords would have to commit to no evictions from 60 days of the last payment. So I don't know if it's just me, but I'm just thinking, does that include this payment, of course, and does that look forward at all? In other words, how far does that go? Through the end of the year, or is that retro to a date on which they paid previously?
Commissioner Carter, Madam Chair, great question. We had a lot of conversation about should we implement that type of a date. So it would be 60 days from the date of the last payment, but ideally that last payment would go through December 30th, okay, from when the CARES funds in, or when we have to utilize the CARES fund. So really looking forward, we want to give tenants those extra 2 months in the new year.
I see. All right, thank you. Wow, you guys have done a bang-up job putting this together. And I know that people in the community are going to be very, very thankful, not to mention those landlords who are really working to manage this at this point in time, but certainly the folks who are in the units that would otherwise be a potential for foreclosure. Thank you.
Thank you.
Thank you, Commissioner Carter. Next, I have Commissioner Matos-Castillo.
Yes, thank you, Madam Chair. This is really exciting and fantastic. I just wondered how, one, landlords reach you so that they know they can apply for this, and two, how do they know about this? Obviously, you're sharing it with here, but do you have some, like, are they going to get a letter, an email? What's the strategy to get this out to landlords? And in particular, I'm thinking about our nonprofit landlords who many of them have been impacted by the lack of rent, like Aon and Common Bond, that have affordable housing, but also have had not all their rent payments received. And so how do they, get engaged and get this assistance?
Great questions, Commissioner Matos-Castillo and Madam Chair. So we plan on posting the program on our website as well as on social media. We also have been in contact with Housing Link so they can get it out to their network, as well as the Minnesota Housing Agency. So we really want to leverage those other community partners so they can spread the word about this program.
And then what's the number, or how do the landlords, are they calling the main kind of phone line at the county, or is there a specific line for landlords to reach the department?
There is a specific number. I can get that for you. I'll put it in the chat, but there is a dedicated phone number that will get answered by a live person.
Excellent, thank you.
Thank you, Commissioner Matos-Castillo. Commissioner McGuire?
Thank you, Madam Chair, and thank you, Director Curry. This is amazing, and everyone that worked on it. I know you thank the long list of people that helped make this happen. I'm curious. I'm going to ask the huge question, and if you've already said it, if you could just elaborate on it. So we're trying to maximize the time frame that we can use the CARES dollars, and if they end at the end of the year, so then you're hoping it can go 2 more months, like January, February, and then what is going to happen in March? Are we going to have all these people? Are we going to have people evicted in March then, or could you just help me understand this and just how, what we've got coming up? And I know we've all talked about this, that we're worried about the future. I mean, we're grateful for this happening now, but do we have plans for the future without knowing, what's going to happen with the CARES dollars?
Great question, Commissioner McGuire. The plan is the department's going to look at our TANF block grant dollars. That's where we allocate dollars for our emergency assistance program, and we may be able to shift some of those dollars and increase the amount of emergency assistance available for families in 2021.
And Tina, if I could add one thing on that, Madam Chair, Commissioner McGuire, Tina's working within every available constraint with her team and across this organization to find ways to do it. When the conversation continues to go for why do local governments need more money, this is one of those answers. You should expect that the eviction moratorium is likely going to continue through the winter. I just don't see the governor wanting to lift it in the middle of the coldest months. That will bring another cliff our way. We need money so that we don't end our program with a one-time shot and get to do it again. And of course, every dollar Tina has to move with her team from another place creates another issue of need. This is why we need federal and state support going forward into 2021.
Thank you so much for that reminder, and we will be working as hard as we can on that. So thank you for that reminder that that's our work cut out for us.
Thank you, Commissioner McGuire, and then I will go to Commissioner Ortega.
Thank you, Madam Chair. Most of my questions have been answered, so I just want to say great job to Tina and Amy and the rest of the team. Thank you.
Thank you, Commissioner Ortega. So I still see hands. I don't know if those are residual hands. We have about 2 minutes left on this topic. So Commissioner Carter, do you have another question?
I'm just bad. Take me down.
Okay. How about Commissioner Manis-Castillo? Do you have another question?
Yeah, I just had one quick question. I love all this work on housing, and it just leads me to, will this work be shifted over to our housing stability office come the new year, or will it remain in FAS around these services, especially with the landlords? So just curious about how that all plays a part.
Thank you for that question, Commissioner Mata Castillo. Honestly, we haven't delved into that, and there hasn't been a lot of discussion. Focus and attention has really been on the creation of the program. So where it lands going forward, I'll have to get back to you.
That's a great question. Thank you so much, Director Curry. This is, I'll echo just the praise and the extraordinary accomplishment of getting this together. This is really exciting and really fits with our vision and mission. So thank you to you and the team and everyone who put forward some innovative problem solving to really address this need in a different way. With that, I believe Maria Weatherall is next up.
Thank you, Madam Chair. Commissioners, Maria Weatherall, Ramsey County Veteran Services. And I am going to talk to you today about the Veteran Registry and provide some updates on our department's work to reinvent service delivery during COVID times. I'm going to switch those topic orders. So I'm going to go first just to a brief update of the work that we're doing in the department to try and remain responsive as we actually all kind of adapt and change how we do business. So what we did, just as a snapshot, just to give a starting point, was to look back on the last 3 years, and we pulled activity in several areas of the business and considered what that information told us about the work that we're doing. I'll just remind you that in addition to the impacts of COVID, our department is currently operating with 1 FTE, which makes a big difference in a small little department like ours. It is a Veteran Services Assistant position, and that position primarily responds to initial inquiries and questions and assists with some of the higher level requests that we get coming in from the public. So we really needed to adjust not only based on the difference in how we do business during COVID, but also just to adapt how we serve people with that one position vacant. I did opt to leave that position vacant until 2021, just thinking that I needed some time for the dust to settle for us to understand better how long we would be experiencing this change in business that we have from COVID, and just opted to just give that some time before I fill that position. So I think, you know, that is out there and potentially we can hire in the future, but for now felt like we just needed to move forward with the work. So we took a look at the calls coming into our main line, and what we saw there was that the calls are down coming into the main line about 30%. And some of that, I think, has to do with the change in how we do business. We needed to shift some of the workload to the veteran service officers, and we needed to adapt how we were serving people now that we were no longer seeing people in person in the office at appointments. So we see that the second column of totals is the total phone calls coming in overall, which is down only about 7.5%. And some of the reason I think for that is that a lot of the way that we have changed and adapted the way that we do business is that we do a whole lot more of our business by email and by direct web-based services that are provided by our primary partners, which is the Veterans Administration and the Minnesota Department of Veterans Affairs. So the services provided by our veteran service officers are represented in the last column of totals, and that we see a 14% increase in the activity for our veteran service officers, which does include email, fax, phone, and all of the web-based activity that they do. I think the most remarkable change that we see in our business is that business done by email is up about 79%. So we're doing a tremendous amount of our business by email now. So I think between adapting how we serve the public directly, and some of that is veteran service officers, because they're doing fewer appointments, because they are not out in the community as much doing outreach events and presentations, because they are working from home and utilizing technology to do their work. They are more readily providing their direct line numbers to the public that they're serving, and they are increasingly using email and other web-based services to submit applications, to file claims, to communicate with our partners, to coordinate services. So we do see that in our totals. I want to provide some reassurance to you that we feel very confident that we have continued to be able to be responsive even as we address these challenges which are provided by the fact that we cannot see people in person. I mentioned when I did the budget presentation that for us, assessing people, meeting them in person, talking with them about their unique situation is a huge part of building trust. So we actually had to find new ways to build that connection when we encounter new people and for the people that we're serving ongoing. And I think that the staff, all of the staff has done a tremendous job with adapting, even as we all kind of feel that discomfort of like not being able to like look people in the eye and speak with them directly about their very personal needs and situations. So looking forward, I just wanted to talk about the fact that we will be continuing to seek ways to provide more effective connections to the benefits, programs, and services that are provided by our partners, internal and external partners. I do speak primarily of FAS, of public health, of social services, of corrections. So we are very, very interested in continuing to find ways to be more effective in representing those benefits and programs and to make those connections for the people that we serve. So that is a priority for us going forward. We will continue to try and adapt how we serve and improve how we serve. And one of the ways that we're hoping that we can do that looking forward is by finding ways to effectively use these service centers. We are in a service center building. We are very hopeful about the model. We see the activity and the success. We see the potential. And we want to be a part of finding ways to bring that to the service of the population that we serve. I think we have the great advantage of being in a service center building with a parking lot. When it comes to county government programs, it doesn't get much better than that. So even during these COVID times, I think, we see opportunity with the service center, and we're hopeful that we'll be able to find ways to use that effectively. I think when I talked to you at the time that we did the budget, I talked about the fact that we continue to be very interested in seeing people in person, and finding ways to do that will remain a priority. But I think the events of the last couple of weeks have left us feeling like we did not want to move ahead with any kind of initiative in that regard without the full support of our public health and leadership. And I think, all signs are pointing to proceed with caution. With that said, we do have staff that are out in the field every day, meeting with people in person and serving people in person. And we will continue with that effort, but we want to be very, very cautious and consider the safety of the people that we serve and the staff that are serving them as we do that. With that said, I won't stop singing that song of we want to see people in person. So we'll keep working on that. The last thing I wanted to comment on about what we see going forward is we do see a need to try and reinvent how we do outreach. And to that effect, we have met with communications, and we do plan to meet with them again in the new year. We have a plan for Veterans Day. We have been doing some events, and we do have a big event that's coming up here on Thursday that we will be participating in, which is a statewide event, a huge virtual event that is kind of by design replacing stand down, and it is a further enhancement of outreach in the COVID age. It's called E2020, so we will be participating in that. But we do see that, an example, we did a huge number of events in 2019 where we went out into the community. We spoke to groups anywhere from 5 to 50. We were present in locations where there were large numbers of people that we could outreach to. We did an intensive advertising campaign several times over the course of the year. We did a postcard mailing. We did several other efforts in collaboration with our partners in the community. That has all changed. We can't rely on Market Fest next summer. We can't rely on the state fair. We won't be doing the stand down events this year where we are all together in person in one location. But we still want people to get the message that we are here and we are interested in serving them, and that will not change. So we are very, very interested in identifying how we can reinvent outreach in the pandemic age. We do think there's some possibilities for learning from our partners across the county. I'll use the example of Workforce, which was one that was kind of represented to me as a good example of a department that's tried to find ways to adapt how they outreach the public so that they can continue to provide great service. So that is just a brief update, and I'd like to pause right now and offer to take any questions you might have on this particular topic before I proceed to talking about homelessness.
Okay, I'll check in. It looks like Commissioner Reinhardt has a question.
Thank you. Maria, I really appreciate this information and how you can see how the services have gone up, which is expected actually during such a challenging year. And so, you know, it's one of the conundrums that we've had to deal with is the need for services goes up at a time when it's harder to get to people to let them know that the services are available. And and I think you can learn from some of the other parts of the county as far as how they have reached out. I've been very impressed with the town halls and different venues that that will allow for that outreach. But this is a group that isn't necessarily, some of them may not be as tech savvy, but then let's be realistic, not all of us are, regardless of whether or not we are veterans. But I think that there is a lot to learn from that. I have to tell you that when you were talking about the reality of where we are at right now, it did remind me of the fact that recently, my two older brothers are both Vietnam vets, and my oldest brother, as you know, is suffering from the effects of Agent Orange. And so recently we divvy up the holidays in our family. So my oldest brother does Thanksgiving and has every year. But he and his wife sent out a text saying that after careful consideration, they just realized that they needed to cancel. They couldn't do it. And I knew how hard this was on my brother. And so I responded to him saying, thank you for loving me and caring for me so much that you wanted to keep me safe. And it meant the world to him because he was feeling guilty and I was thanking him for doing the right thing. And that's what I heard from you. And that, yes, we all want to see people in person. We miss people. And just day-to-day conversations that we've taken for years have taken just for granted that we could always have that outreach. But you have to be realistic and you have to care for people and love individuals enough to say we can't do that right now. Or if there's other ways to do that outreach. So I so appreciate it, and that message just really resonated with me, and I just wanted to say thank you. Because that's what it shows. It shows the respect and it shows the caring and love that you give to all of the people that get your services.
Thank you so much.
Thank you, Commissioner Reinhardt. I don't see other, Commissioner Mattis-Castillo.
Yes, thank you, Madam Chair. Thank you, Maria. I know that this work, 2020 has been challenging for all of us, and it's especially challenging when, you know, so much is relationship-based. And so I appreciate the adjustment. I know it's tricky for all of us. I wonder, in the spirit of collaboration and in partnering with other departments in the county or other service providers, you know, if someone is coming in either from financial assistance that needs help or maybe workforce and they've been laid off, are we identifying them as veterans so they get a second touch from your department? Or are they in one pot or another?
Commissioner, Madam Chair, are you asking about if an employee from workforce, or are you asking about a client from workforce?
A client.
Okay.
Yeah. So if a client comes in, do we ask them if they have military service, and if they say yes, can that be shared with your department so they get a second touch from a veteran outreach worker that might be able to have a deeper conversation of what else needs they have?
That's a great question. And I think that two things I would offer. One is that the question about whether or not you are a veteran was added to the CAF some years back. But I don't think that we have necessarily done any kind of a direct referral from people that we encounter in FAS or in social services to veteran services, unless there was perhaps a specific need. One comment I will make is that my staff is increasingly known by the departments to be those that would advocate on behalf of veterans that they might encounter, either workforce, FAS, in particular social services. So I think that referrals are made, but not as consistently as what you're describing, which would be hugely beneficial. It would be wonderful. And then I think, for example, workforce, they do have veteran specialization within workforce. So I think their first referral would be within their department to that individual. And then that individual does know, oh yeah, if this has to do with possibly wanting to, for example, apply for a COVID disaster grant or a distance learning grant, but we need to get in touch with Veteran Services to be able to do that. So
yeah, I really appreciate that. I think it would be really great if, you know, department-wide, county-wide, if we have that direct referral system, especially, and I know the like, are you a veteran got added, but as you and I both know, that's a problematic question for 100 million reasons. And so it really needs to be, have you ever served in the military? Would it be okay if I referred you to our veteran service officer? Because there might be more benefits or not even. Veterans don't know the questions to ask, right? But if they come to you, you can help them. The other thing is that then we're doing an automatic feeder and people are like, wow, I got service above and beyond. The other thing is that it eliminates the disparities. This comes up a lot, and I know I preach this a lot. And Maria, we've had lots of conversations, is people fail to ask women, people fail to ask people of color if they have ever served in the military. There's an assumption that veterans are white men, and that is simply not the case. And it happens when you say the word veteran, everyone conjures up what they imagine in their mind, and that might be a veteran, but there's also a million other images and people. And so I think there's an opportunity, and I hope that the other folks in Human Services are listening, is that as a matter of protocol and process, if someone is coming to the county for services of any kind, whether that be workforce, financial assistance, is to say, have you ever served in the military? Would you like us to do a referral in addition to what we're helping you with today to Veteran Services? And I think we will be surprised at how much better we do our work. So anyway, I'll get off my soapbox, but thank you, Maria.
Great, Commissioner Mattis Castillo. Maria, I think you have more content, so maybe we can move to that, and then if there's time for additional questions at the end.
Sure. Okay, so I'm going to give an update at this point about veteran homelessness and the veteran registry. And I wanted to just give just a brief little bit of context, which is really interesting in light of what the commissioner was just talking about in terms of how people envision a veteran, you know, the white male. I wasn't able in the past to talk about the 2018 Wilder study, which is a deeper dive into homelessness that is done every 3 years. And that was because there was a huge delays in that information coming out. Well, that information did come out in May of this year. And a couple of the things that I thought might be of relevant as I talk about current homelessness in Ramsey County were a couple of just primary facts that the Wilder study found. Now remember, this is 2018, October of 2018 that this was done. It found that 93% of homeless men, veterans, were men, and that the average age of that individual was 53, which is fully a decade older than the average age of the average homeless person. The majority of homeless veterans are older, and they experience homelessness later in life. Veterans of color are disproportionately impacted by homelessness, which is no surprise. And that the reasons that veterans end up homeless really largely mirrors those reasons that other adults end up homeless, which would be eviction, lack of affordable housing, mental illness, untreated, undiagnosed mental illness, substance issues. So it largely mirrors what we see with the larger homeless population. I did want to point out that one of the things that the Wilder study found was that the total percentage of people experiencing homelessness who are veterans has gone steadily down from 1991 to 2018. So while these numbers that I'm going to talk about right now, well, they feel very alarming to me. I just want to give just that little bit of context that even though these are still high and there are still vastly people experiencing homelessness, including veterans, that number has gone down since 1991. So here in Minnesota, we get a weekly update of the continuums, and this is the snapshot of the registry numbers from 2 weeks ago. And so what it shows us is there was 65 homeless veterans in Ramsey County. There's now 66 as of this week. Statewide, there's 298 homeless veterans currently. So I did want to mention that between the end of September and the present, the number of homeless veterans has gone up by six, from 60 to 66 right now. So we see on that snapshot that about 69% of the veterans that are currently experiencing homelessness in Ramsey County have no housing plan. And that really mirrors what it is in Hennepin. And Hennepin and Ramsey do stand apart in not only the number, but just the character and what we see in terms of whether or not they are VA eligible, whether they have a housing plan, whether they're chronic, whether they're living unsheltered. The metro area has a whole different, I'd say, experience of homelessness among veterans, and it largely mirrors that of the general homeless population. So I just wanted to, I know there's been questions in the past about the definitions here, and so I just wanted to remind that housing plan, I know Ryan has asked this in the past, does mean that the individuals that are listed as the 19 are actively pursuing housing. They actually are following up on leads. This would include people that would be eligible for HUD-BASH vouchers and who are actively searching right now for housing. So 65% of the total number of veterans that are homeless in Ramsey County are VA eligible, which means they would be eligible for VA services. And that includes not only the full health care services, but it also includes drug and alcohol treatment, case management, mental health services, et cetera. The one caveat to that I would give is that if you are VA eligible and you and your advocate are seeking a HUD-BASH voucher, you must be willing to cooperate with case management. So I think therein lies one barrier to even people who are VA eligible accessing HUD-BASH vouchers, because they do have to be willing to cooperate with case management. Next slide. So I wanted to give you a quick snapshot. I've talked over the years quite a lot about our work with the Homeless Veteran Registry. We've been a partner in that effort since 2014 when it was launched. This slide shows you a snapshot of the current registry. We do continue to expand our work as part of the Homeless Veteran Registry partners. We now have the Veteran Homeless Justice Outreach Worker, who is a veteran service officer. We do have a veteran service social worker. They both attend the registry meetings bi-weekly. They are in attendance there with our other homeless registry partners, which includes the Veterans Administration, the Minnesota Department of Veterans Affairs, MACV, and other partners, both from within the county and from the community. So the partners meet bi-weekly and they go through the registry, and the slide, as you can see, provides a snapshot of information about the individual. This particular evolution of the registry has provided a lot more functionality. It has allowed them to track notes, to track the barriers, to track who is working with the person and when the last talk with the person. They track whether or not they were on the registry before and have returned to the registry. So this particular evolution of the registry has been really valuable to the partners, and I think it's really changed the entire way that those biweekly meetings happen. So I wanted to say that looking forward around the registry work, just in the specifics of the group that does the biweekly meetings, we do see a lot of movement in the partners, and we see an increasing interest in trying a whole lot of different things to collaborate and work together. A lot of the people that we serve, Ramsey County Veteran Services, that being our veteran justice outreach worker who serves people who are living unsheltered, and our social worker, are working with some of those that are the most challenging on the registry. These are individuals that they've met either in unsheltered settings or in detox, people who are discharging from the hospital that are referred to us, people who are working with VA who are referred to us. So many of these would fall into that chronic category of individuals that are listed as homeless in Ramsey County. I did want to mention that our veteran justice outreach worker, Chris Vinden, who was actually initially given to us from the state and is now a permanent employee of Ramsey County Veteran Services, has done an incredible job of integrating with the work of the community. So he is fully integrated into the work of unsheltered homelessness within Ramsey County. And I think that has hugely benefited in terms of serving these folks with these incredibly challenging barriers. Chris has created bonds with people and has reports that he is increasingly called upon to work with those that are really challenging to keep relationships with. He described a recent experience he had to me where he had been following the veteran who was suffering from addiction for over a year, had been maintaining a relationship with him. The veteran called saying that he was experiencing a crisis of symptoms and he was worried about it. Chris went out, was able to verify that the veteran was having the withdrawal symptoms. He was able to connect him with medication. He was able to take him immediately into services and bring in healthcare for the homeless to work with him. Because he knew who his doctor was, he was able to contact his physician and get him an appointment. He did take him back to the encampment where he had picked him up. And on Monday, the following Monday, he went and picked him up and took him to treatment. And that continuum of relationship is sometimes what you have to do to ultimately bring the person to the point where they want to be housed. And this individual wrote a note to a partner that said, without Chris Vinden actually staying committed to me, I would have never been able to face going to treatment. I would have never gotten into treatment. So I think that's an example of the importance of investing in individuals, in people, and taking the time to actually have those longer term relationships that you go along with them on their journey for more than just a minute. Next slide. So I just wanted to give you a quick snapshot, and this is like looking back on the last, since the beginning of the year, and I compared how we were doing in the beginning of the year to September for 2018, 19, and 20. And I did a similar kind of a presentation to the Commissioner's Task Force a couple of weeks ago, and worked with the state, and the state is doing a deep dive into data right now, and I think we're going to learn a lot from that. But essentially, I think what we see is that there is seasonal effects on homelessness. We do routinely see an increase in numbers towards the end of the summer. And traditionally, I think that has had to do with stand down. In the more recent time frames, we did not have stand down, but we did have better outreach, more coordinated outreach, a more effective way of adding people to the registry. We are still down from a year ago at this time, but it's been a really, really challenging year. It just trying to find ways to bring people to that point where they want to go into housing and are ready to change some of the things that are part of their current lifestyle, whether that be living unsheltered or other. It's just been very, very challenging this year, but we are still down from last year at this time. We do experience a different kind of challenge in the in the urban counties, and I don't think that's going to change. But one of the things that I think that I feel hopeful about is that there are a lot of new things on the horizon that we are trying to work with. And I think some of those have gained attention and traction during the pandemic for whatever reason. So an example might be the way that we have utilized hotel programs to help people to stabilize so that we can work with them and more effectively help them navigate to the point where they can move into their own housing. So I think we're going to learn a lot from the hotel programs. I don't know whether they'll continue, but I think that we will learn a lot. I think that we will learn a lot from the pending deep dive that is going to be happening into the registry numbers. We do see the state expanding efforts to engage landlords and to work with a Beyond Backgrounds program, which was previously done by Housing Link. We have seen some focus on efforts to increase income for veterans, so better partnerships with DEED. And most recently, I did hear that there are conversations going on about UGM attempting to adapt some of their housing units, some of their rooms to permanent housing. So finding ways to convert some of those units that they have into permanent housing. I'm not sure if how many of you know, but there are, because UGM is got a lot of units that are not considered permanent housing, but are actually, I think, comfortable, stable locations where people do stay for a long time. We do find that we have quite a number of veterans at any point in time that are actually living at Union Gospel, and that is their home. They really don't. They don't have a strong motivation to find other housing. So this is a great development if they can actually adapt some of their units to permanent housing. Last slide.
I do see you there, Chair Carter. I'm going to let Maria get through this last slide. We are, and just as a time check, we are about 10 minutes over the time allotted for this topic. So,
I'm so sorry.
All right, I'm just time check.
Had no idea. Sorry, I'll just be brief here. This is a snapshot of the registry dashboard that the Minnesota Department of Veterans Affairs maintains. And we actually are working right now to link the dashboard to the open data portal. And we're very hopeful that we'll be able to accomplish that by the end of the year. This is a really easy, great tool that you as leaders could use to just find out, take the pulse of local homelessness and that in the region and around the state. With that, I'll take questions. Sorry about that.
That's all right. It's good information, so I didn't want to cut you off. I've got a question from Chair Carter.
Thank you very much. This won't be long, but as you looked at or showed us the data from the Ramsey County Registry, it just struck me that the end of this year increases in numbers, and it is not surprising because of the COVID economy that we're in, and that having an impact over time. I do notice though that last year, toward the end of the year, spiked up tremendously. And I wonder if you have anything to share with us about what we were seeing there at the end of last year. We are under those numbers now, but it appears as though that was just such a dramatic and unexpected spike from what we saw earlier in the year. Would you comment?
No, I think sometimes, I'm sorry, Madam Chair, Commissioner, sometimes, with increased efforts, the numbers of veterans that relocate and add to the registry surges. And we do see that in late summer into fall. I think additionally, you're always going to see, and you can kind of see it in that pattern, that, we're probably, connecting with more veterans as winter is, pending. And the expectation that that there are going to be challenges associated with living outdoors becomes increasingly apparent. So it could have something to do with that. I don't have other explanations, and I found that very interesting also.
Thank you. Commissioner Mattis-Castillo.
Yes, I'll be fast. I just want to really commend you for all of your work, and Chris Vinden is amazing. So yay, Chris.
Yes, thank you so much.
Yes, thank you, Maria, for all of this. This was very interesting, and will you be sending links for the dashboard and that information as well? Wonderful.
Absolutely, absolutely. Thank you.
And with that, I think we move to Ann Berry and Sophia Thompson for the Roll 20 update.
Ann, you're on mute.
Oh, goodness, thank you.
We were going to see how long you were going to go, but then we decided that would be kind of mean. But Sophia and I had a bet, so keep going.
Yeah, and I could have gone on probably a long time. So good afternoon, everyone. Sophia and I are going to do this presentation together around Rule 20. You can go ahead and move to the next slide. So in the human services world, we use acronyms and rules to describe almost everything, and it's very frustrating. So I thought I'd just take a step back and talk a little bit about what we mean by Rule 20. We wanted to be clear in our presentation that we were talking about people who are living with mental illness and involved in the criminal justice system. And the law was written, the statute was written, it's probably 25 or 30 years old by now. But the point really of the statute is to protect people so that they have a fair trial. So simply Rule 20 was created so that a person couldn't plead, be tried. They couldn't be sentenced in a criminal court if they couldn't consult with counsel on a rational basis. They didn't understand what was happening in court. And people need to be able to participate in their own defense. If you have a mental illness or a cognitive impairment, you might not be able to participate in your own defense. So these are people who have been charged with a crime. And then the question is, will they be competent to stand trial? So the court then will order a competency examination. There's a motion that is made by the court. Either the judge or an attorney on either side can question whether a person is competent to stand trial. The criminal proceedings are then suspended and an examination is ordered. The examination has to be done within 60 days. What we try not to do is to keep people in jail during the entire length of time it takes to do an examination. In some cases, the courts will allow a person to return to the community. Sometimes the examination takes place while a person is in the hospital. So the whole point is this person competent to stand trial? So the examiner sends a report back, and then the judge makes a decision about whether somebody is competent to stand trial. And if they're competent, they go through the criminal process. But if they're not, and they're incompetent to stand trial, well, that's what we want to talk about today, because this is what's happening in our system when people are deemed not competent to stand trial. Generally, about 50% of people who have been deemed incompetent at the same time don't meet the criteria for commitment. So what you have is a group of people who are not competent to stand trial for their criminal charges, yet at the same time, they're not, their illness is not expressed in a way that it's enough to get them into a court commitment. So this is one of the groups of people that we're very concerned about. We're very interested in doing everything we can to meet the needs of people who need support and services so that they can not only live their best life, but not commit future crimes. It used to be the Department of Human Services did what was called competency restoration, but they stopped doing that about 2 years ago. Well, it looks like November of 2018, so almost exactly 2 years ago. And there is nothing in statute that requires competency restoration. So that's something that Sophia will talk about in just a few minutes when we think about what we need to do for people who are caught between two systems. We can't commit them civilly, but they're not going to face criminal charges, but they still need support and help. The other thing that has happened at the DHS level, at the state level, is somebody can now no longer be placed in an Anoka or St. Peter facility for the purposes of competency. And it's not considered a factor when placing someone in a psychiatric facility. So we often have people who are placed in, even if they're deemed incompetent and placed, say, like in Anoka, the Anoka treatment facility, they're released almost immediately back to Ramsey County because they don't meet a psychiatric standard of care. So we're caught in a really difficult position, as are people who are who live with a mental health issue, who have families and loved ones, are trying to figure out exactly what can we do to provide people the support they need. And I just wanted to provide this as a backdrop to the discussions that we've been having with community and partnering with NAMI in a better understanding of how we can serve people. A couple other things I want to talk about. Well, one more thing particularly is to really fully understand the racial and ethnic impacts. One of the first things when Sophia came on board and I came to social services was to begin to ask the question about what do we know about the race and ethnicity, and other factors, age and gender. And it turns out we know very, very little. So Sophia and her staff have begun to do a lot of work to really understand, we know who's most impacted by the criminal justice system is at the same with people who are living with mental health issues. And so we're doing some work to better understand who we're serving in Ramsey County so that we can do the best we can do to provide for people where they are at and to meet their needs. And this is just a backdrop, so I want to turn this over to Sophia so she can take us through the next couple of slides about what we're doing to address what are changes in the system.
Thank you, Anne. I appreciate that. Madam Chair, Commissioners, nice to be here with you all this afternoon. As Anne has given kind of that history, we call it, wanted to be able to tell you what our response has been. It's important to understand that this, what we call Rule 20, it really crosses multiple departments and areas here within Ramsey County. And so we knew that as we started to draft our response needed to be inclusive. And so one of the things we started with was forming this a discussion, and I call it a multidisciplinary countywide team. This included folks from Safety and Justice, the Integrated Health and Justice Administrator, Mr. Greer, also Mr. Richard Stevens from Safety and Justice. We also had Healthcare Services, Interim Manager. We had Tim Carey from the County Attorney's Office, myself. We worked with the governmental affairs, Claudia Brewington, who was here, and multiple others across various departments. I'll include Sarah Holly. We connected with her and her team at some point. So this was a very intentional, collaborative effort to obtain information of what should we do when DHS, when the Department of Human Services made a decision to make some changes in how they were going to respond to our traditional means of where these residents, how they would be served. And so, again, this response was very intentional in being inclusive of many. We also wanted to do some research review and learn more about what was needed. One of the things we've learned is that with the multiple departments involved, everyone has a different way of collecting data. Everyone has different focus areas. And so in my area, our pre-petition screening area sees and does an initial assessment, if you will, of those who receive this Rule 20. I was going to diagnosis is not the word, but this characterization in the court process of getting a Rule 20. And so with that, some of the research we've learned is that once residents are provisionally discharged, providers are not always able to maintain engagement. And so anyone who has this designation receives a case manager. And it's important that the case manager follow them during this time. We also have learned that housing providers may not be equipped to manage the needs for these individuals. For clients who don't meet the level of commitment, we don't have additional resources within our current system to work on engaging those individuals in service. We also struggle with accessing psychiatry and/or mental health services. We also know that takes time. So when a person comes out of the hospital, getting them set up with an appointment can take time. When individuals are requesting support, it can be really difficult to be able to support them in these efforts. By the time a psychiatric appointment is set up or the chemical health assessment is scheduled, oftentimes residents are no longer interested. We have a very small window of opportunity to engage and support residents with getting into the next appropriate level of care when they're undergoing this process. Those were some of our learnings. As we were doing this dive into better understanding this population, we hired a project manager, Evelyn Combs, to come on board to assist us with some of our more intentional work. We also applied for a grant opportunity from the Department of Human Services. It was an innovations grant. And we again collaboratively put a proposal together of how we might not solve the problem, but try to influence this area. What we were very clear about during that proposal is that we would not be making the full decisions on how to solve this problem or how to influence this decision. We would rely on the community to give us feedback. From there, when we applied for the grant, we clearly stated that's what we would do. And so we've had 2 town hall events. We had one for the community that was really more for the providers within the community. So service providers, case managers, those who work at IRTS facilities, which is a level of care, a setting in which the individuals can, when they discharge from the hospital, can stay at an IRTS for up to 90 days. We asked these providers to come and give us information on their experiences within the Rule 20 population. We also held an internal town hall meeting. This meeting focused on specifically Ramsey County departments. Again, this collective idea of what are we experiencing internally. After those 2 sessions, we sent out a survey so that anyone who maybe wasn't able to participate or to provide additional information, we ask them to give input via survey. And then the last step the next step, I should say, with this community engagement effort really is to reach out to individuals who have this designation of a Rule 20. We have asked case managers, we have reached out to, again, multiple departments to say, if you know of a resident who had this designation, we want to hear from them. And so we will be we're in the process of scheduling individual interviews for those who want to participate in an interview. And then for those who prefer to do a survey, we're offering a survey to get their feedback on what was that experience like? What could have been done differently? What could have prevented them from either going into the hospital or going to jail during this experience? So we're really taking this opportunity to learn from those who are the experts, which are not always us here at the county. So the Innovations Grant really is going to, we will focus on what we learn from the community, we will implement within that grant. Anne, were you going to jump in?
Oh, do you want me? Am I the next one?
No, ma'am. I thought you were going to jump in. I just wanted to double check.
You're good.
So then the next part I wanted to talk about is just the considerations. As we're going through this, there were several considerations that we looked at. One of those are the changes that have taken place with direct care and treatment at the Department of Human Services. They, as you may be aware, have closed at least one facility recently, the Como IRTS. Again, that is a location where residents would go when they come out of the hospital. They would come to this IRTS facility. Now, there are other IRTS facilities in Ramsey County. This one was very structured and one that we really like to use for our residents. Also want to think about the resident impact. We know that with when an individual goes under this process, the time it takes can be substantial. Residents sit in jail longer than necessary because the evaluation must take place as they are transitioning. It's hard to find and maintain placements, and there's no competency restoration in the community. As Anne had mentioned earlier, competency restoration was done at direct care and treatment, at the direct care and treatment sites. The process now may start there, but once an individual is stable, psychiatrically stable, and ready to leave the hospital care setting, there is no place for them to get competency restoration in the community. And we see that as a significant gap. We also lose people in the community, either before their examination or if they do not meet the standard for commitment. So this process is pretty complicated, and I'm not sure that I'm explaining that the entire process. It is very difficult, challenging process. But one piece that I would like to stress is that if a person is released from custody prior to the examination, there's a chance that we lose them. And so they're living wherever they're living, and oftentimes some of the time they will come back with a new charge, a new crime that was committed, and then we start this process over again. Ramsey County has screened approximately 68 Rule 20s between January 2019 and October 2019. 33 of those referrals met criteria for commitment. Approximately 10 others came as transfers from other counties. And once a client is no longer meeting medical criteria, they are discharged from the state hospital. And that's this idea of being psychiatrically stable versus the old standard of actually, finishing the program because of a lack of space. For one reason, that's not the only reason, but one reason is a space issue. Let's see here. The last thing I'll talk about is the client's emotional and psychological health may also decline while they're waiting for this process to be discharged into the community. So that's another consideration. As far as resources go, when returning to jail, clients are unable to resume adequate mental health treatment, also leading to a decline in health. Valuable county resources are spent repeating this cycle of stabilization, and this includes additional strain on the community related to new criminal activity, something we really want to be mindful of. You may recall there was a competency restoration task force that has been established. There are several folks from Ramsey County who are on that task force, really looking at what are some next steps. And then the other consideration, as I mentioned in the beginning, is partnerships. In order for us to do this work, we really have to partner together. This is not something that's isolated in one department. It crosses many of our departments. And so as we are looking at our next steps, we are collaborating with our various departments. And I want to make sure that, is there anything you want to add to this area?
Nope, I'm good. We can move on to next steps and then take questions. Why are we here today for this conversation? Well, first of all, we want you to be aware that we are having conversation not only internally, but more importantly with the community and those who are impacted and have been designated under Rule 20 as someone needing support for their mental health issues, to address their mental health issues. As you can see by Sophia's presentation, that there are big gaps in this system, front end, middle, and end. And so what we need to do is to work with community, work with providers, work with others to try to figure out how to best fill in those gaps. And we won't be the only one filling in those gaps. We will work in partnership with community providers who are doing some of this work. But we want to begin a discussion about potential service development, whether that's on the residential side. You know, as Sophia pointed out, we don't want people to stay in jail while they're awaiting determination of competency. We'd much prefer that they be placed where their mental health needs can be addressed so that their mental health needs don't deteriorate, but at the same time, we don't want to lose them to the system. So we need some residential options. We need day programming. We need treatment. We probably will need to find a way to start doing competency restoration to determine if somebody is competent to stand trial with criminal charges. You know, as I said earlier, about half of the people who are referred for a competency assessment they're deemed incompetent, but they never meet commitment requirements. There has to be a way for us to address the needs of those people as well, and then provide other supportive services, particularly not just to the clients, but to their families and the community and the neighborhoods where they are living. There are probably some opportunities for us. Sophia talked about the Como Ertz facility closing. We had a conversation or in conversation with DHS to try to understand the decision they've made and why they made the decision they made and what their plans are going forward. I don't think they're going to retrench on their decision to go back and start providing competency restoration. They have no incentive to do so, but all of the counties, including ours, are struggling with, so what do we do and what do we do next? So as we continue to engage with community and hear back from community, and again, those who provide support to people living with mental health issues in the community, what we've heard over and over again is we need residential support. We need day programming and treatment if we are really going to provide people with the support they need and to keep them out of the criminal justice system. So I'll leave it there. At that point, we are prepared for questions. I know we're a little over time. I'm sorry about that, but if there are questions, we are here to do our best.
Great, thank you. I do see a hand from Trista, but I'm not sure. Commissioner Manis-Castillo, I think that was a residual hand. So I'm not seeing any. Oh, I got a question from Commissioner Carter.
Thank you.
Commissioner Carter, I'm having trouble hearing you. Is your microphone positioned?
Thank you. So I know that this has been a long time coming. You all have been working on this for quite some time just to understand the changes as a result of DHS's decisions and the directions we might head in. And I know that you're sharing this information today in the interest of helping us to understand the depth of concern and to prepare for likely recommendations that you'll be prepared to make. Is there a partnership you just mentioned that other counties are having the same concerns and given DHS is not going back over the decision, are we talking collaboratively within the metro area about the county's needs to address this issue? I know you continue to talk with DHS. Is there a possibility of a collaborative approach?
Yes, Madam Chair and Commissioner Carter, absolutely. We're all in the same position. We've all been left in the same position because not only is the department not providing competency restoration, the closing of the IRTS facility particularly hurts Ramsey County because that's where it's located, but other counties use that facility as well. So yes, the conversation with other metro counties it will also be a part of our future discussions and part of our future work. Counties have been involved with, like I said, with the Department of Human Services. We historically have all addressed this separately, and it hasn't served us very well. So yes, we need to all work together. There's one other thing I should point out too. This work started probably 2 years ago when Katrina was in the integrated health and justice position. She went on maternity leave. Lerone Greer took over for a period of time. Katrina came back and then almost immediately went off to incident command. I am happy that Katrina has now got a little more time. So she and Sophia have been partnering up as well. So I want to also recognize Katrina's, the historical part of Katrina's work. And then also to Tim Carey, I think Sophia mentioned Tim. He's also on one of the DHS's task force, the Rome Competency Restoration. So I didn't want to leave either of them out in our presentation today. So we can easily begin discussions with other counties. It's not complicated to find IRTS facilities in Hennepin County. There are a lot more in Hennepin County than there are in Ramsey County. We also want to have programs here in Ramsey County so that people, it's not far to cross the river. It's not hard to go to Anoka County or Washington or other counties, but we really do want to build up service support here in Ramsey County so people are close to their homes. So we'll consider and try to balance all those things at the same time.
Thank you.
Thank you, Director Berry. I'm not seeing any other questions. So we want to turn it back over to Karen Saltis to close us off.
Yes, thank you, Commissioner Fretham, and thank you, commissioners. This is my last time of leading this committee of the whole, and I just want to thank all the commissioners for their support over the last 7+ months. Also want to thank the county manager and the executive team who really supported me in this role, and most especially to the health and wellness service team leaders and staff who really have made it a joy to be leading in this position during a pandemic, and none of us knew what was going on, and they've just made the job of being in the interim DCM much, much easier than it could have been. But I do really appreciate all the support I've gotten from that team and from all of you. And I know Ms. Hedin is going to do a fabulous job, and I'm still around, and we're continuing to work on a transition and through the transition. And thank you all for your attention today. This is a great group to lead, and thank you so much.
Well, thank you, Karen. Is there anything else that needs to be said before we adjourn?